Dr. Williams, you have an incredible background as a physician, as a leader of healthcare organizations, and now higher ed. Is it really true that we have a crisis in the nation, in the boardroom, and at the bedside?
Yes, it is true. It's true both in healthcare and both in higher ed. I see it in both places. But especially in healthcare, which is what we're focused on today, it's occurring at all those levels. But I come back to it's especially occurring in the areas of leadership.
So tell us about the Fredericksburg Memorial Hospital story.
So when I was practicing at Fredericksburg, I had the opportunity a few years earlier to sit in an audience and hear Dr. Berwick speak of the escape fire story. And that got me very tuned in to the patient safety issue across our country. And then a few years later, I got the opportunity to become the CEO of the hospital and implemented some patient safety initiatives, and was surprised at how much pushback I got in the hospital environment. And continued to have that conversation with our team, and then we ultimately led to showing them the Chasing Zero movie, which quickly got them aware of how desperate the situation was. We showed the Chasing Zero to our board, and then we rallied our team around an opportunity to improve. Subsequent to that, we had a 13-year-old boy, Quinn, who came to our emergency room, and ultimately Quinn died as a result of some congenital anomalies, but ultimately we treated their family horribly. And we learned many lessons about how we could improve better, and we did not help Quinn and his family have an opportunity to have a good outcome by the way we treated them. And so we used Quinn as a rally call as to how, and his family became involved with us in turning our hospital around to be a leader in being safe and treating families as a center of care.
Well, you have an amazing set of accolades. Top 10 finalists for Malcolm Baldrige National Presidential Quality Award. You won the Malcolm Baldrige National Best Practice for Leadership. Truven Top 100 U.S. Hospitals for 2012 and 2013. Recognized by CMS as the #1 hospital in Texas and the #1 in the U.S. for patient experience in the last quarter of 2012. Top 5% in U.S. Patient Quality, Patient Safety Award. It goes on and on. Leapfrog, you won an A, the Texas Hospital Association Award for 2011 and 2012, and Health Grades and Texas Quality Awards of other kinds. This is an amazing set of accolades, and yet you were ranked below 4,000 and had this turnaround in the face of incredible financial pressure. This was not a wealthy hospital that came out of nowhere with these great accolades. How did this happen?
It happened because we took the time to put a great team together, and we rallied around a vision of creating remarkable care for all of our loved ones and our neighbors. And ultimately, I think it really came to the team understanding that, and me as well, that we were nothing more than mediocre. And mediocre hurts and kills people. And so we made the conscious decision to rally around a new vision, and we set our sights on the top decile of hospitals in the country. We're using Press Ganey data and other data we could find. And those were, even though they weren't in our division of small hospitals, we continued to wanted to play with those bigger places that had resources that we would never have. So we focused on what changes could we make at the bedside, in the boardroom, with our team that cost next to nothing. It was mostly just human to human effort.
So that's incredible. And you were a practicing physician at that hospital earlier, and when you were a doctor and you brought in the escape fire story to a prior leader, they blew you off.
Right, they did. They really weren't interested in hearing the story of the escape fire or even addressing or talking about patient safety as even a major issue.
So the next thing you know, you're the CEO of that same hospital under enormous financial pressure and having to actually give money back to CMS,
right.
And at the same time focusing on patient safety and quality, because I know our audience that we reach out in our national research test bed are facing the same doggone things, enormous cost pressures and having to do more with less.
We as a small rural hospital and a sole community hospital, we're struggling, and we're struggling to make a margin every year. But we focused on doing the right things at the right time with the right people, and we had a team dedicated to that. And that's what turned the whole thing around. It wasn't anything I did except just as a leader to try to focus our team on the vision that we could do this, and it wouldn't cost money. And then we got our board engaged, and they understood the plight we were in, And we talked to them about an opportunity to use this as a differentiator for us against other hospitals, because we knew that there weren't many hospitals focused on these issues.
So what's your message to those national leaders that know we're in crisis, those leaders in the boardroom and those at the bedside? Because we've got that audience in the group that are listening to you.
First of all, I think they have to understand that as a leader, we have to take personal accountability. We have to understand that every one of us are patients at some point in time, and even now or in the future. And if we don't address this problem, ultimately, we and our families will be affected, friends of ours will be affected. And so what I would say as leaders is, first of all, take an assessment around your leadership team and understand, first of all, do you have values that you're all aligned with? And then what are your personal values, and are those personal values shared by the whole team? And are they correlated in a way to where you can focus on one vision? But if you don't have a leadership team that focuses on the same set of values, you can't address these hard problems.
We love practical and tactical things that we can give to our audience that they can run with. Give us the capsule on your hero book.
So every Friday or every day, we gather our team for a huddle every morning, and typically Monday through Thursday, that huddle is around getting the day done and focusing on our priorities. Friday is a special day because it's called our hero huddle, and all of us have a red moleskin notebook that we carry, and we bring that to the Friday huddle. And in that huddle, we go around the room, and every executive team member gives the name of someone across the entire campus that they've seen going above and beyond, taking care of our students, taking care of patients, taking care of each other, or even a community member. What have they done that's above and beyond? And we recognize that person. Then we pick a volunteer from the executive team to go talk to that person, explain that they were nominated and that they were set up as a hero for the entire campus. And we give them a letter ultimately. And we've seen our frontline team members put those letters up on their walls, share them with their families, and it's created an environment where people love being recognized and want to be a hero.
And it doesn't cost anything.
It doesn't cost anything. It's the cost of a letter, piece of paper, nothing.
So now you're leading one of our major educational centers, and actually you're producing the #2 number of primary care physicians in our country. So you really having a major impact, and you have 2,000 people that are responsible for teaching 2,000 people, and 5 schools and 10 degree programs. What are you doing from what you've learned to help us with this crisis that we've got nationally?
Well, one thing I would also add to what you said, Chuck, is we also have the opportunity in our clinical practice to see almost 550,000 to 600,000 patients a year. So we have that piece as well. And I think because of the diverse population of the Health Science Center, we had to come back to the center and we had to say, what are we as a community going to be? What are we going to be defined by? And we started off by defining what our team values were. And we brought our frontline team, we brought community members. We went through a process to where and out of our whole population, we had over 800 people participate in a survey around values. It gave us their values. We aligned those and we came up with our top 5 values. And with those values, then we put behaviors with each value. And then we set up trust as the final 6th value, if you will. And we see these values as, if you will, the piers or the rebar that goes into the foundation of the cultural transformation we're building. Because we want this culture to withstand pressure for years to come and be sustainable leader after leader after leader. And so it had to come to what are the values of the team, not my values. And so that's what's going to be the changing force for us.
Well, congratulations on being able to do it in probably the toughest place in the world, which is where our audience lives, out there at the front line, enormous financial pressures and not having any financial resources to call on. And you've been able to actually win in the game that really seems to require a lot of resources, and now applying it to education. Thanks for the inspiration.
Thank you, Chuck. I appreciate the opportunity. And I want to appreciate all those in the audience and what they do every day for taking care of patients better.
An epilogue to this video story regarding leading through crisis is the announcement of Hill Country Memorial Hospital winning the 2014 Malcolm Baldrige National Quality Award, one of only 2 hospitals in the nation to do so. This illustrates the concept that great leaders are clock builders, not time tellers, as observed by Jim Collins, the best-selling author and business guru. In his first best-selling book, Built to Last, he describes how great leaders establish the values that deliver long after they have served. Congratulations, Dr. Williams, and your team of clock builders who've given the gift that keeps giving.